Hello everyone, welcome to another Members Minute. This is Michelle Hamburger and I am here with Dr. Kevin Connors. Today we are going to be speaking a little bit about enzyme therapy and its relation or benefit to anybody who's dealing with cancer. Dr. Connors, I'll let you take it from here.
We're not going to go in depth because this is supposed to be a Members Minute. I have other videos on this, like this one right here, enzyme therapy, that go into the details on who really started this and where it came from and its use with different types of enzymes. But now we're just going to get into the enzymes that we use typically. So, brief overview. The idea of enzyme therapy with cancer is not to help with digestion. It's to help break down the waste layer around a growing cancer so that other therapies, including chemotherapy and natural type chemotherapies, can get into the cancer and kill it. So that's really the idea of high-dose enzyme therapy. These are some of the enzymes we use, but not all of them, because we are so big on enzymes, we have lots and lots of different enzymes. So we test people on the different enzymes. This one here is probably our favorite, the Digestimes X. But we use another one from professional health products. That's a pancreatin enzyme as well. But this one I think has got a little more power. But again, we use what tests out on the patient. Now these were really created to be digestive enzymes. So people would take Digestime or HCLzyme with their meal to help digest their food. The purpose of taking high-dose digestive enzymes for cancer is not to help digest your food, but again to help digest the cancer. So you're taking these away from food. So typically you might take them right away when you wake up in the morning or when you go to bed at night. You can take them during the day, but you want them about an hour away from any food because you want these enzymes to be absorbed across the gut wall and then circulated in your system to help be able to attack that cancer and that slime layer around the cancer. Now there's numerous other enzymes, I said, that are in the US enzyme line and others that we use that are very specific. The Czyme, the Cerezyme, and the Therazyme are specific to different tissues. We won't get into that in detail here, but we test people on what's going to be their best one. So if you came to us as a client, patient, member, then we might have you on this and not on the others, and that's just how it goes because we're going to test you. We might not have you on any of these because it didn't test out. Again, it's not for everybody, but it could be a nice little addition.
Mm-hmm. Are there particular cancers that respond better to adding in enzymes as a therapy?
Well, historically, through Dr. Bard's work and Dr. William Kelly's work and Dr. Gonzalez's work, they were the people who really put it on the map. Historically, pancreatic cancers, liver cancers, colon cancers tend to respond to enzyme therapy a little bit better. Mm-hmm. And we have found that to be true tested kinesiologically. They're more likely to be patients with those type of cancers that we will be using these on and test that way. But it's surprisingly it can be other things too. So it's a nice addition.
Mm-hmm.
All right. Well, that's a little brief minute, and we will talk to you again soon.
Thank you.